speaker is Dr. Meireles, associated with the San Diego Mafia, will express their experience with single center experience with a novel, purely endoluminal fundoplication device.
I'd like to deeply thank you, the Mafia, for being here. So, ladies and gentlemen, Mr. Chairman, thanks for SAGES for choosing this article so we can talk about our work here. So, where's the mouse? Perfect. Think I have nothing to disclose. So gastroesophageal reflux disease is highly prevalent in the Western world. As you know, in the United States, about 1/4 of the adult population will be experience a GERD-like symptoms once a week. Many treatments are being proposed and used from medical to surgical, and the surgical has evolved from open to laparoscopic and robotic surgery. And in the recent years, a lot of new endoluminal techniques and devices being populated in the market. In our study we're trying to do is to assess the safety, feasibility, and efficacy of a novel a computer-controlled flexible endoluminal stapling device for the treatment of GERD. So this was approved by our IRB, and the following inclusion criteria was a history of GERD for more than 2 years in a conformative pH study, and plus those patients should be taking PPIs with a significant relief of the symptoms for at least 6 months. Exclusion criteria is presented over there is the presence of hiatal hernia greater than 3 centimeters or any type of 3 or greater hiatal hernia, Barrett's esophagus, grade 4 esophagitis, esophageal stricture, or any other anatomical abnormalities of the esophagus. All those patients underwent like a preoperative EGD, esophageal manometry, pH study, and Barry swallow. The device is the SRS from Meireles and has this computer central control who has ultrasonic capabilities and a software who helps guide the anvil and the cartridge to a proper and optimal stapling placement. That's the device, the plicator, which looks very similar and behaves very similar to a gastroscope that on the central shaft and the metal portion, that's where all the staples are. The head has a ultrasonic probe aligned with the anvil and 2 little channels where screws are deployed for a docking with the shaft and properly aligned with the cartridge for a optimal placement of the staplers. Plus, it has all the additional features of a regular gastroscope. That's the handle, and the procedure was under general anesthesia. EGD was performed and an overtube was placed, and then following that, through the overtube, the flexible plicator was introduced, and endoluminal fundoplication was performed. So this animation here would show that once the scope retroflex and you start using the ultrasonic beam to guide the head towards the shaft, the screws are deployed by allowing proper docking and placement of the staplers. That's being performed 3 times anteriorly, performing anterior fundoplication. So this is a live case here, not live, but one that we did on our patients. That's exactly how the image looks like, and there is all those little numbers on the screen, which they actually mean a lot. On the left upper corner right here, what you have is the angle of retroflexion, which tells us how much are we retroflexing. That's opposing through the tissue, and you see that angle changes. And as get close to 300, we start having like an ultrasonic beam recognition by the machine, which tells us that we are engaging the head with the shaft. Following that, we perform a screw deployment here, which have a percentage, and as it goes, there is a gap number here, which is decreasing the tissue purchase to the optimal size of between 1.35 to 1.6. Once that happens, and then we go ahead and fire the staples. So this is at the end of a firing, so we can have an idea and see how it looks, where I have one stapler here and another one stapled placed over there. At the end of the case, we also perform a upper flexible endoscopy just to look if there's any bleeding and to confirm our fundoplication. So just immediately after surgery, we obtain a chest X-ray, and 1 day after surgery as well. And they go through a post-op diet very similar to what we use for our Nissan patients. Our results were, by the time we submitted this abstract, were 4 patients. So far I have done 11. and all of them underwent through this endoscopic fundoplication. The average operative time was 78 minutes. The length of hospital stay was about a day, no complications, and all patients immediately felt the relief after the symptoms after surgery. So purely endoluminal fundoplication is promising, is feasible, and safe for human use. This technique certainly represents a potential alternative for laparoscopic fundoplications, and advantage of creating key steps of surgical fundoplications are seen with this device by doing like full thickness purchase of the tissue in a controlled environment. In conclusion, our preliminary data demonstrates that this is favorable for results for. Our preliminary data demonstrates favorable results of this technique, and certainly like a larger sample size and the long-term results will help us determine if this would be a considerable alternative application of endoluminal devices for the treatment of GERD. Thank you very much.